Go ahead.
Good afternoon. I'm Bevan Baker, City of Milwaukee Health Commissioner, and I'm joined today by Dr. Seth Foley, who is the State Health Officer and Administrator for the Division of Public Health here in Wisconsin. Today, the City of Milwaukee Health Department is reporting that Milwaukee now has its first death related to the novel H1N1 infection. This is also the first death in Wisconsin. This case involves an adult who had a common underlying medical condition that made the risk of influenza and its complication deadly. We will not provide any additional information or health-related information identifying this individual. This is in accordance with our internal policy and federal law. However, the conditions that make people more at risk for the complications of influenza include if you're over the age of 65, or if you're under the age of 5, pregnancy, heart or lung problems, including asthma, emphysema, an immune-compromised system or immune suppression, diabetes, and some other chronic medical problems. At the onset of our investigation, we stressed that H1N1 is a new virus in which no one has any immunity, and for which there's currently no vaccine. We anticipated that there may be deaths. At every step along the way, we've taken prudent efforts to protect the people here in Milwaukee. We continually see increases in our daily case count, and we're also seeing increased numbers in the number of persons who are hospitalized with H1N1 infection. As of this morning, there were 1,240 confirmed cases of H1N1 influenza reported by the City of Milwaukee. We expect this number to increase as our continued surveillance and testing happens here within our community. So, if you are ill, we ask that you stay at home if you're exhibiting these signs of respiratory illness, including fever, cough, sore throat, and don't go to work or school. In addition, it's extremely important for individuals to continually spray good hand washing and hygiene practices, covering mouth or nose when they cough or sneeze, as we said many times before. I want to turn the podium over to Dr. Seth Foley to talk about how we need to medically case manage this current H1N1 and engage with medical providers. Dr. Foley.
First of all, on behalf of the Governor and Department of Health Services, we express our condolences for the affected family here. What is unusual today is not that there has been a death from influenza. As many of you have already reported, 37,000 people die in the United States each year of seasonal influenza, and the rates of death and illness from this novel H1N1 strain does not appear to be radically different. What is unusual this year is that influenza continues to be widely circulating in Wisconsin and many, many other states this late in the year. And our message is to both the medical community and to persons who are in the high-risk groups that they need to think influenza even though it's June. Ordinarily, rates of influenza-like illness would be much lower than they currently are at this time in both Milwaukee and the southern tier of the state and throughout the state. The implications of what people should do different is as follows. If you're a member of one of the high-risk groups that Mr. Baker had listed, children under 5 years old, particularly those under 2, those 65 or older, children who are on long-term aspirin therapy, and people with chronic illnesses, lung diseases including asthma, heart disease, liver or blood disease, neurologic or neuromuscular problems, and metabolic problems including diabetes. So diabetes and asthma are both very common. Pregnant women, individuals who are immunocompromised, and residents of nursing and other residential facilities. These are individuals who are at higher risk of hospitalization or death. These are individuals who, if they have fever and cough or sore throat, we hope they will waste no time in calling their healthcare provider, and discussing whether or not antiviral treatment should be used. Again, to many doctors in our community, they're not used to prescribing antiviral medications in June. And so for these high-risk groups, those who are symptomatic, a fever over 100, sore throat, or cough, it's time for the discussion to happen between doctor and patient about the use of antiviral therapy. Thank you very much.
We'll take a few questions now.
What hospital did this occur in, and are you confident that exposure has been contained, or are you worried that there could have been people in that hospital waiting room or other areas of the hospital that may have been exposed?
Again, we're not going to provide any specific health-related information or identifying information, just to say that it's a hospital here within the Milwaukee community. We believe that all our local hospitals are taking the appropriate precautions to protect staff and patients from H1N1 infection.
So how did the person take an ambulance to the hospital? Did they walk into the hospital? Can you tell us how this person presented to the hospital?
I don't have that data. We do know that this individual's had a common underlying medical condition that increased their risk for complications due to influenza.
Is it an older person or a younger person, male, female?
This is an adult.
When did the person die?
We have confirmation of the first death as of this reporting time. So we have laboratory confirmation and confirmation of the death as of today.
Okay.
How old
When
is
did
this
they actually
individual?
die?
The age is not germane. This person is over the age of 18 and they're an adult.
Now that there is a death, though, doesn't that change the what you can say now that there has been a death? Doesn't some of that confidentiality pass now?
We will always be in compliance with federal law as it relates to privacy information surrounding any patient in any hospital. We had 17 deaths nationwide due to H1N1 infection. We anticipated a death. Unfortunately, it eventually come to Wisconsin. It's happened now, and our policy is not to divulge that information.
What day included in that 17, that total?
The CDC will probably update their count as of this morning, and we're reporting that out now. The state of Wisconsin would actually report to the Centers for Disease Control. So I'm not certain if that 17 is including this report out.
How long was the person in the hospital for?
I don't have that data. I do know the individual succumbed to complications due to H1N1.
You mentioned that more and more people are becoming hospitalized because of the swine flu. Is this because of there's been a change in the strain of the swine flu, or is this because of these people have underlying medical conditions?
I'll have Dr. Foley address that.
There's an increasing curve of more and more people in hospital beds every day, but what is unusual is that the number is higher than the seasonal. What is seasonal typically does not appear to be going down yet rapidly. So I don't want people to think that this is escalating, but it is failing to go away. Many of your questions are reasonable, but it is really important for the public to understand that there's a lot of this virus floating around in the community. Those who need to worry about it most are those who are at risk. Hospitals are taking the position that has been recommended by the state that people who present with fever and cough should be isolated from the rest of the patient population, and infection control measures are put into place. So the recommendations about who needs to seek treatment more urgently, to whom the treatment should be offered, when testing needs to be done, and the infection control measures recommended for hospitals are all online at pandemic.wisconsin.gov.
Now, are we talking about H1N1 or the regular flu?
We do have special recommendations for the H1N1 given the novelty of the situation, although in many of the particulars they resemble the recommendations for regular flu. As it turns out, the antiviral medication recommended for the novel H1N1 flu, to which that virus is susceptible, are oseltamivir and zanzamivir. The seasonal flu strains, which we've stopped largely seeing in our community, were resistant to those drugs. So doctors and nurses can feel confident in using those drugs when confronted with a flu-like illness.